welcome everybody to this afternoon meeting, which is just a day before the pre-independence, Republic Day. And we bring greetings to you for this Republic Day. We all know the health. Wait a minute a little bit. Let me just introduce. We all know that the health of people is very important for a nation. And in fact, मैं कहूँगी कि जो health हमारी भारतवासियों की है वो पूंजी है और विकास के बहुत सारे जो मानक हैं स्वास्थ्य में वो स्वास्थ्य से जुड़े हुए हैं. Today our focus is going to be on the newborn, and you know, as far as when we got independence in 1947, the neonatal mortality rate was 150 and today stands at 30. So we find that, you know, in the last 75 years, as for the health of the country is concerned, we are advancing by leaps and bounds. I'll give you another example that the longevity was, when we got independence, was just 32 and now we are 70 plus. There are other achievements also. There was one AIMS in 1956, first one, and now we are at 15. There was 7,000 private and public hospitals were there in 1947, and we are at 70,000. As far as India has become, it is soon becoming going to be a pharmacological hub because we are known to give cheap and effective medications and vaccines across the country. And now Narendra Modi says that anybody which has to sell in this particular country has to be formed here. Now, in this particular note, I think we come down that to the newborn, our focus is. At birth, the newborn assumes many functions which till now the placenta has been doing it in utero. We all know that immediately after delivery, there's a cardiopulmonary transition, there's a thermoregulation. But today our focus is newborn nutrition and how effectively the newborn learns to assimilate the calories, the water, and the electrolytes. We all know the term baby and slightly preterm baby. The breastfeeding should get started in the golden hour. But the tragic part is that not more than 5% institutions are following this particular protocol. We all know about the golden rule. But 5%, not more than 5% is, I'm exaggerating. Not even 5% are using this golden hour opportunity. But they are introducing breastfeeding in a matter of 2 to 4 hours, and that is also not seen in the big hospitals and especially the public hospitals. So today what we are going to see that everything is available. As far as the mother is concerned, there are a few drops of a very precious milk is available. And baby is wide awake after delivery for first 1 hour. So one can easily put the baby to breast, which is easily possible. And thereafter, we are told that, you know, the baby sleeps for 2 to 4 hours, and that times it may be difficult. So today we have two powerful speakers today. One is Dr. Vikram Reddy. He is going to speak about the golden hour. He's just reminding each one of you. And the second presentation is by Dr. Pratima Mittal, who is again stalwart as far as Kangaroo care is concerned. In fact, both Dr. Harish Chellani and Dr. Pratima Mittal has been taking this particular model to across the world, and they've visited many countries to show their own experience about it. I think we will definitely get rich. I think many of us have seen their center in Saptajang. It has been absolutely wonderful. So there's so much to offer. So here I will ask Dr. Jyotsna because they have a lot of experience to make your opening comments before we start. We ask the first speaker to give his speech.
Thank you,
Jyotsna.
Yes, ma'am. Thank you. So, ma'am, you have already set the background for today's talks, and we are talking today about first talk will be on the golden first star. So this concept of golden first star, as is there in all diseases, recently this has become a very, very important topic in all diseases. You know, whatever we are talking of, whether it is sepsis, whether it is CVA, whether it is MI, it is the golden first star which decides the future or the life of the person. So here, when we are talking today of the golden first star, it is not only going to, we are talking about what is going to be the life of that neonate, but it is also something much more important, a stepping stone for that infant, I think, which will impact his or her entire life, the mind as well as the body. So it's something very, very important, and we are all looking forward to Dr. Vikram Reddy giving us this concept of the first feed of the baby, which is the golden first star. Within the first star, the baby's feed, what is the importance and what kind of feed should be given. So Dr. Vikram has got a very unique combination of medical education. I am seeing his CV, and he is also done the PG diploma in medical law and ethics from very, very renowned national law school. And also he has got a postgraduate diploma in intellectual property rights and law. So he's got a huge experience also in conducting trials, and he has done a trial on alcohol withdrawal syndrome, as well as he's into drug development, clinical trial research, and biotech management and project startup. So,
Doctor, we will ask Dr. Chellani also to make a comment, because he's the only pediatrician available with us. Dr. Chellani, you would like to make any opening comments? Dr. Harish Chellani. I think if he's not there, then we'll ask Dr. Vikram Reddy to go ahead.
He can make it in after the talk.
Okay, that's it.
So, Dr. Vikram, the stage is yours. Yeah, please start your talk.
Yes, thank you very much, ma'am, and I thank the association for giving me the opportunity to present this topic for the panelists and also for the esteemed guests who have arrived today for this meeting. So it's my pleasure to be on the stage and also to present this short topic on golden hour nutrition. Before starting my presentation, I would like to say that because the obstetricians are the doctors who would be involved in taking care of the mother when she becomes pregnant till the time of the birth. And also, like during this time, so they'll not only be taking care of the mother, so they'll also be taking care of the baby inside the mother's womb. So obstetricians plays a very important role for both management or keeping the health of the mother as well as for the baby. And today we are extending that care, which can happen for first 9 months to 1 hour more after the birth of the baby, where obstetricians can also play a very important and critical role, because this 1 hour is very much critical for a newborn baby when it comes to nutrition per se. So we will be talking about the golden hour after the newborn's birth and what can be done in the golden hour, and mainly sticking to the nutrition part. As a human milk feeding within the golden hour, so how can it impact the baby's life? But that 1 hour and also for the lifelong time. So thank you. My name is Dr. Vikram. So I'm from Bangalore. I'll be speaking about this recent advances in golden hour nutrition for newborn babies. So if we are starting about the golden hour, so it's defined as the first hour of postnatal life, which begins once the baby is born. That is the first hour. So as Dr. Jyotsna just told us that the first hour, that is the golden hour, is there for almost all the diseases, and it's mainly for the emergency and acute care. And this is also stays good for after the birth of a newborn baby. And this first hour, or is the golden hour in the life of a newborn, can make or can be the deciding factor of how the baby benefits, how the baby takes the health benefits in the future or in the long term purpose. So we all know that breastfeeding to be initiated within the golden hour. So that is one of the primary, most important statement which the WHO makes, and also majority of the organizations do have given this statement. And if, for example, mother's own milk is not available, so the next best choice is the pasteurized donor human milk whenever mother's milk is not available. And we will also be discussing why to avoid the formula feeds, especially in this golden hour for any babies. So WHO also says that 1621. So this is the numbers that they highlight. So 1 means breastfeeding should be started within the 1 hour of the birth, and 6 means exclusively breastfeeding for 6 months, and breastfeeding can be continued till age 2. And this following 162, this can save at least 1 million lives per year. So this is the impact that breastfeeding, that is also human milk feeding, plays an important role within the first hour of the baby's birth. So let us see what happens if in the golden hour, if the breastfeeding is not done or the human milk feeding is not done. So human milk feeding during the golden hour can prevent almost 1/5 of all neonatal deaths. That is the deaths which can happen in the first 30 days of life of a newborn infant. And it is also been said that through research, babies started on human milk after golden hour, like after 1 hour or after 2 hours, they have the risk of dying almost doubled up. So if you don't feed the babies within the first hour of the birth through breastfeeding or human milk feeds, so the risk of mortality increases by almost 2 times. And 58% of newborn infants are not receiving human milk feeds within the golden hour. So this might be due to many causes. It can be medical or it can be non-medical causes. But as a whole, the country, so almost 50% is able to adopt it and provide this feeds within the golden hour time. And almost 50% of the babies are not so lucky enough. So if you want to go further down the line, so 16% of all neonatal lives can be saved if all babies are breastfed within the 1 hour of the birth, and 22% if breastfeeding was started within the first hour. And neonatal mortality can also be decreased markedly if the breastfeeds are started within the 1 hour of the birth. So if you want to compare and see how the other countries are doing, so we can see here that is West and Central Africa is at the lowest, that is 35%, and East Asia and Pacific is almost at 41%. South Asia is a little bit better with 42%, and more is there in the Eastern and Southern Africa, that is 60%. And this might be due to the economic status where there might not be affordable to use formula or any other type of feeds. They should rely upon the completely breastfeeding or human milk feeds. So that might be the reason there. And in the least developed countries, it is almost again 53%. So we can see that the early initiation of breastfeeding across the regions where the countries are still developing or still underdeveloped, it is at the range of 50 to 40, that is 40 to 50%. So there is a long way to go for us to exceed this percentage and reach at least 60 to 80% in the upcoming 3 to 4 years. If that can be done, I think we could be saving millions of newborn lives. So, that is the C-section, that is the cesarean section, also plays a very important role of letting the baby have the breastfeeding within the 1 hour or within the golden hour of time. So we have the experts here today. I think they will be the better judges, or you will be the better judges to comment upon this. So this is the C-section rates across India. If we can see, it is almost between the ranges of 20 to 30% in the northern region, and coming down it can exceed 40% and more. So anywhere the average is almost around 30%. So among all the deliveries which is happening, 30% is taken up by the cesarean sections. So of course, urban areas have the C-sections more, which is happening in the corporate hospitals or in corporate setups. And rural area, it is still less. But LSCS, so it has also impact on that is the golden hour feeds or the golden hour nutrition per se. So if we see that how many babies who are born out of LSCS, that is a cesarean section, how many of them are getting the breast feeds or human milk feeds within that golden hour or the first hour. So we can see that beyond almost 60% of the babies who are born of LSCS are getting the feeds beyond 1 hour, that is well beyond the golden hour time. And only 41% who are born out of LSCS sections are able to get the human milk feeds, or mothers are able to breastfeed the baby that is successfully within the golden hour. So there is almost 60% that is who are not able to get the human milk feeds within the golden hour. So if we can slightly adjust or make our protocols to make these mothers or make human milk available for these babies within the golden hour of time, so that would, I think, that would make us to provide a healthy life for the newborns and also save neonatal morbidity and mortality to a greater extent. So one more implication of feeding which type of feeds and what is the timing of these feeds to the infants also matter, because once after the birth, so when is the baby getting the human milk feeds and after how much amount of time? So that also matters for a baby's gut development. As we can see here in this study, so they have given us the differences between how the good bacteria is developing in different sets of babies. For example, if the baby is born through normal NVD, that is normal vaginal delivery, we can see that almost 25 to 40% of bacteria which is developing in the gut of the baby immediately after the birth is a good bacteria. So this is which is very important for the gut development of a baby. So this also implicates if a probiotic or a prebiotic effect is more in the baby's gut, that also provides an implication on the immunity status, because gut development and immune system development goes hand in hand and also goes parallelly as well. So better the gut immunity or better the gut infrastructure which is developing through probiotics and prebiotics, better will be the gut immunity and better will be the overall immunity for the babies. So of course, because the delivery is through normal vaginal route, the good bacteria in the stomach of the baby is more, almost 40%, and with the little percentages of infective bacteria which can also be there. But this would not be a problem in these normal vaginal babies, because the good bacterial content is up to 40%. But in the same manner, if we see the cesarean born babies, so babies born through cesarean section, for the first, which means you can see that for first 4 hours, the good bacteria in the infant stomach is very, very less. That is almost as equivalent to 10%. So that is the least amount of good bacteria in the baby stomach born through cesarean section. And others, like majority of the bacteria is formed through the disease-causing microorganisms like Enterococcus, Streptococcus, and Staphylococcus. So if these organisms are if they are in the higher numbers, they can lead on to gut disorders or also gut infections later on. And it takes a lot of period of time. For example, 4 days to 7 days, then 10% of good bacteria will become at least 20 to 30%, almost 15%. And by 21 days or by the age of 1 month, the cesarean born babies are getting the probiotics or the good bacteria at the level of normal vaginal babies. So it will take almost 1 month for the cesarean born babies to develop this normal good gut bacteria and at the level of normal vaginal delivery for almost 1 month. So that's a period of time that the cesarean babies are almost actually getting to take or build up their gut bacteria, or good bacteria in the stomach. So in this time, so human milk plays a very important role, especially for cesarean born babies. If the human milk or breastfeeding is introduced immediately after the birth of the baby, then we can see that the good bacteria definitely goes up more than 10 to 15%, of which is noted down here. Because human milk is the largest source of prebiotics, which can help the good bacteria in the stomach to proliferate and increase in number, so that the gut bacteria will definitely increase. And also human milk also has a lot of immunoglobulins, and among them the most important is the secretory IgA, which sticks to the mucosal lining of the stomach and protects the stomach from the infections. So that will also play a very important part and provide a local immunity for the gut for the newborn babies. So this would only be possible if the human milk or breastfeeding would be started within the golden hour of time for all the cesarean born babies, so that the good gut bacteria will definitely increase, and that also will provide protective benefits for the neonates and also for all the babies who might not get any such diseases or diarrheal episodes later on. So there is one more study which shows that by the day 6, only 20% in the cesarean section group had regained their birth weight, compared with 40% in the normal vaginal, NVD group. So we can see that the weight gain also is a very much important parameter for all the newborn babies. And formula-fed infants in this study are subjected to excessive loads of water and substrate. So formula feeding is definitely not advisable for the babies, especially if they're born out of a cesarean section, especially in the golden hour or the first hour of the birth. So it should be the human milk, and human milk feeds within the golden hour time not only provides the benefit of immunity, that is as the first vaccination to the baby, but also helps in the development of the gut, and also gives a better better growth for the babies in terms of weight gain. So the right choice of feeds or the nutrition for the babies after the birth or within the golden hour should be the breastfeeding or mother's own milk. And if for some reason, if mother's own milk is not available, or the mother is unable to lactate within that 1 hour of the time, so it is better to go for the pasteurized donor human breast milk, which can be taken from any of the milk banks. So this is the first choice, and this is the second best choice for all the babies, especially in the golden hour of the birth. So feeding type also provides a significant influence on the gut bacteria. So if, for example, if we see here, if we feed formula to the babies within the golden hours, so we can see that the number of good gut bacteria is very much low here. And in that place, if we provide just the mother's own milk or even the donor human milk, so that will provide a better good bacteria to the stomach, and also better good protection to the gut of the newborn babies than the formulas. Because as I told before, human milk is the largest source of probiotics and the best source of prebiotics. And there are a lot of studies and also the research which is available today that it is saying that if the babies are fed with human milk or breastfed within the first hour of the birth, they have compared their IQ scores after they have reached 20 or 25 years. So into two groups. So the group which received the breastfeeds or human milk feeds within the first hour of the birth had a increased significantly, statistically significantly more IQ scores than the other group which were fed with formula or any other type of feeds within the golden hour time. So this also provides that how important is the human milk feeds or breastfeeding within that golden hour time. And here we can see that this is the pictures which is taken from the research study. So here we can see that there are two pictures of the brain scan of the MRI scan which we have taken. So in the first picture, so this is the MRI scan of a baby which was fed with not with breastfeeding or not with human milk. So this baby was fed with mixed feeds, that is partly with human milk and partly with formula milk. And we can see the neural connections, how the neural connections are developing in this baby. And this is also a different baby, but of the same age and also the same weight. And this baby was, unlike this baby was, this baby had human milk feeds on breastfeeding right from the start, that is right from the golden hour. And we can see the MRI image here. So we can see the network of how the neural connections are developing in this image. It will be more, so we can see the network and neural connections becoming more and more dense here. That means the brain development is happening in a faster rate. But whereas a formula-fed baby or a mixed-feed baby, so we can see the neural connections are not much dense. So it is taking a lot of time for development of brain. So this again signifies how it impacts the brain development as well. So the golden hour nutrition not only provides the nutrition for the baby, but also provides more than the benefits, more than or beyond nutrition as well. For example, like increasing the immunity or providing better IQ scores, and also reducing many of the chronic diseases like diabetes or obesity or cardiovascular disorders later on in the life. So it also has an economic impact as well. For example, let's take a baby if it is born now, and if we choose the baby to put on a breastfeeding or a donor human milk, so that baby would definitely have a better health after the birth. And if, for example, if the same baby is fed with the formula feeds, if the mother's own milk is not there, if the baby has received formula feeds, then the baby might develop certain complications because of formula feeding. For example, there might be some sepsis, there might be some infections or gut-related disorders. So this might take up a large chunk of the economy to be put on that is treating those disorders. So this will have an economic impact as well. So breastfeeding, starting in the golden hour, definitely provides a cost, that is a cost benefit for the babies and also for the mother, by reducing the cost and also by providing a healthy, better life during that acute time as well, and also during the long-term period as well. So golden hour feeds, so it is being termed under different names. So it is also called as trophic feeds or minimal enteral feeds or minimal enteral nutrition, small volume feeds, etc. So whatever the name is, it's the same. That is the small amount of feeds which can enter into the gut of the baby, which is human milk or through breastfeeding or through direct breastfeeding from mother's own milk. So this will provide a huge benefit for the baby. So even if it is small in volume, the benefits is very, very intangible, or it is very much exponentially more. So when to start trophic feeds? So as the WHO has indicated, should be within the first hour of the birth. And if for all the term infants, and if the infants are preterm, if they are hemodynamically stable and if their vitals are stable with a normal heart rate and respiratory rate, they can also be started on the golden hour feeds with breastfeeding or mother's own milk. If mother's own milk is not available, then the second best choice would be the pasteurized donor human breast milk. So what if due to the non-availability of mother's own milk or pasteurized donor human milk, if the baby is fed with bovine milk feeds or formula feeds, so what is the disadvantages? So there can be emesis, or it can be distended abdomen, and NEC, that is necrotizing enterocolitis, is the complication which can also happen due to bovine milk feeds. And of course, because of all these issues, there might be longer days on IV nutrition. And human milk is also one of the largest sources for providing these immunoglobulins and also immunity to the baby. If human milk is not provided, then there will be no immunoglobulins which would be of use for a human baby through bovine milk feeds. So bovine milk feeds or formula feeding can also lead to infections or sepsis. during the neonatal life or early newborn life. So here we can differentiate what is the difference between human milk and cow's milk, or also the formula milk, which is mostly based out of that is bovine milk, that is cow's milk itself. So protein is in right amount in human milk for a small baby, but in cow's milk, the protein is in higher amounts to suit a calf, but it is not suitable for a small baby, of course. And if we come to the main point here, the anti-infective factors, that is IgA and other immunoglobulins and other anti-infective properties, are only present in human milk and none in formula. So this would be better. So this would be providing not only the nutrition, but also be providing beyond, that is benefits beyond nutrition, like immunity and growth. So there are also a lot of studies which says that babies who are fed with human milk within that golden hour of time have lower rates of ear infection and asthma, diabetes, childhood leukemia, and sudden infant death syndrome. So all these mortality and morbidity can be reduced by initiating the golden hour feeds, mainly with the breastfeed of mother's own milk or the pasteurized donor milk. So what is the recommended to use? So of course, if mother's own milk is available and the mother is able to breastfeed, so that would be the first and primary choice. If the mother's own milk is not available due to many reasons, or due to the cesarean section, or due to any other surgeries, if the mother is taking rest, or due to the stress, if there is a delay in breastfeeding, then donor human milk is the next best choice. So I would conclude this talk just by summarizing the key points that, of course, golden hour time is a very important time for all the newborn babies. And we would require, I think, a protocol or some kind of a strategy to make sure that that golden hour time that babies are getting the breastfeeding or at least the pasteurized donor human milk, that would help us to reduce the mortality and morbidity of all the newborn babies. So once again, I thank you very much, ma'am, for providing this opportunity for me. And I would just wrap up my short topic on golden hour feeds.
I think I congratulate you for such a crisp presentation on golden hour importance, and very beautifully you have highlighted what are the benefits of during this golden hour giving mom, that is the mother's own milk, or in case if that's not available, then donor human milk. And lots of advantage. I think I will ask Dr. Chellani because he's the best person to make a comment, and then I will take comment from Dr. Deepika because she has been taking care of all high-risk newborns, and she will be able to guide us on that particular thing. Dr. Chellani, can we have your comments, sir?
Yes, thank you, ma'am. It's really an opportunity to listen to Dr. Vikram, and I think the evidence is there, but the only thing is that operationally we are unable to do it. That I personally feel that we all healthcare providers have to motivate each one of us, both the obstetrician and the newborn people who are attending the delivery, that first 1 hour when the baby, as he mentioned, the baby is very alert at that time. So that time it is crucial. In fact, we are not doing it for the term babies. What to talk of the small babies? In fact, those babies who are low birth weight babies who are shifted to the newborn unit for assisted feeding, even them, in fact, 70% are just for assisted feeding or minimal respiratory distress. Even these babies also not given this benefit in the first 1 hour. So I think those are the issues, and I totally agree with his talk that there had been the distinct advantages of that. And of course, we need to do all that, effort from all of us. Over.
Dr. Chellani, I'm thankful that you agreed what I said, that in spite of that working in big hospitals, and especially you coming from Dr. Shanti Ghosh department and, upgrading it. If you find you are go-getter kind of a thing, if you could not get it done in something hospital, then you can definitely feel. I feel in a any hospital setup, this within 1 hour thing is I have seen is a very little it is seen. It may be seeing in the rural areas, or maybe where there is no other alternative is there, or home deliveries or things like that. There probably it will be possible. So I think but there is so much to take from this particular presentation to each one of you. It's not that we did not know about it. Let's hear from Dr. Deepika, who has been especially on the high-risk babies. Doctor, what is your comment on it?
I think what is saying is so important, and all obstetricians we should be actually talking to the women during the pregnancy about the breastfeeding. Now, I don't think nowadays people even look at the breast, whether there is inverted nipple during the antenatal examination. But at least we used to make it a routine that we should examine the breast and see that the babies can be fed immediately. Kangaroo care we used to have as a routine at AIMS. So I think that's very useful. So we really need the pediatricians and neonatologists to motivate the obstetricians, and the obstetricians will in turn motivate the patients for breastfeeding. So I think it's a very important issue and we need to work very hard on it.
Dr. Jyotsna, Dr. Jyoti Bhasker and Dr. Anjilla, you have worked both in India and abroad. What is the trend over there? Very short comments.
I think, Dr. Saab, we are not putting, baby to the breast immediately. I think by the time we are waiting for the cord to be clamped, anyway, we are waiting for an hour or so. 1 minute or so. Immediately, the baby, if it's a crying, we should I have learned it, that we should put the baby to the breast immediately before. I think what Dr. Deepika has said, it's very important that we should sit down and talk to our pediatrician as 1:1, and let's learn from our mistakes and not to do this. We were doing this earlier when I was a postgraduate student, that we used to hand over the baby immediately. There's no need for a baby to go to the nursery unless it's important, and if there's a distress, then you can't help it. In our hospital, yes, I don't think so. In a cesarean, we will be able to feed them within 1 hour because they remain in the recovery. But we should do it on the table, and we make sure that the mother is shifted, or we have a Mama Mia team. We have lactational people. In Fortis, Gurgaon, they come to the recovery and they feed the baby there and then. But this is not there with us in La Femme. I think it's a high time that we should learn and we should change ourselves. I think it's very important. Once we decide to change ourselves, we can, if an obstetrician decides to change herself, she can change anybody. I feel that.
Yes, ma'am, 2 things at Apollo Cradle that we did to make it a breast-friendly initiative. First thing is at 36 weeks, we are telling all our patients to have a lactational consultant, one consultation over there, who's going to look at the breasts and who's also going to tell them the importance of the lactation and the feeding, and the family is educated at that time that they need to support the woman immediately after delivery. The second thing is that the cesarean, post-cesarean or delivery, the breastfeeding would never take place. We tried logistically, but we could not manage. The staff was not good. It was not there. So what we have done is at the table, if the baby is fine, before the pediatrician takes the baby out of the theatre, on the table itself, we get the woman in such a way that she's able to breastfeed then and there. And they take about 2 minutes over there. The staff nurses tries to breastfeed at the table so that particular initiation is there. It took a lot of resistance from everyone initially. But once we made a protocol now, nearly, I would say 90% of the babies at the time of cesarean are first breastfed within the first 10 minutes before they're transferred out. So that at least we have tried to make that initiative in the hospital.
Dr. Jyoti, you require a special congratulations being the chief of
thank you, Jyoti, for
the hospital. And I will ask Dr. Jyotsna, what is the hurdle at your end?
I just want to add on one thing here.
Yes.
La Femme has a public milk bank. and none of our preterm babies or very preterm babies get any top feed. They all get milk from Amara milk bank, and which is supplied to other hospitals also free of cost.
I think that's a great effort on a private sector. Things of this kind are coming up, and I think this is the movement we need to get started. That's what it is. Dr. Jyotsna, your comment on it.
Yes, ma'am, I am really very impressed with what Dr. Jyoti has just now told us. So definitely we are working in that direction, that we also do these kind of things, do the counseling one-to-one, especially for the mothers who are having a problem. But I think in a government setup, there are so many challenges, right from the busy labor room, and we don't have any dedicated staff for this. So the same staff nurses, there are 2 or 3 staff nurses in one shift. And when there is a delivery, taking place every almost 5 minutes or 10 minutes, in that kind of atmosphere, it's very difficult to have somebody to help the mother with the initial feeding. So even though we are having, just after delivery, the baby is put on the mother's chest and the sex of the baby is shown, then the cord is cut. So that is the protocol in our hospital. After that, the baby is taken off the chest and then the wipe cleaned and the labeling and all those things are done. And as soon as the mother is stable enough to leave the labor bed, and then she goes to her 4th stage room, then the baby is transferred. So that, I think we have a gap of about half an hour to 1 hour, which is, little troublesome. We are not yet able to overcome that barrier.
I think we'll stop the discussion here and we will go on to our second presentation. This is again an eye-opener presentation going to be. Dr.